Welcome back, students. Let us start with the second session. So in the second session, we will discuss acquired diseases. So you already know that acquired diseases are the type of diseases developed after the birth. And acquired diseases are broadly classified into two types. One is communicable diseases, which are spread from one person to the other person. Second one is non-communicable diseases. They are confined to a person who develops it, which are not transferred or transmitted from one person to the other person. Let us start with some of the communicable diseases. So, the communicable diseases are broadly classified into five types. One, viral diseases, which are caused by viruses. Bacterial diseases caused by bacteria. Protozoan diseases caused by protista. Fungal diseases caused by fungi. Helminthic diseases caused by flatworms and roundworms, helminths. So let us start with the first one, bacterial diseases. First one is typhoid. So a typhoid is commonly known as enteric fever. It is commonly known as enteric fever. It is a common worldwide illness, and it is caused by a gram-negative rod-shaped flagellate bacteria called Salmonella typhi. The disease is common in children of age group 1 to 15 years, and nearly 2.5 million people suffer from typhoid diseases every year. So already I told you, typhoid is commonly known as enteric fever because it predominantly found in intestinal lumen, infects and inflammates small intestine. The mode of transmission. The pathogen enters small intestine through contaminated food and water, or ingestion of food and water contaminated with a feces of infected person containing the bacteria. One, the insects, the potential vectors for transmitting the gram-negative rod-shaped flagellated bacteria, that is Salmonella typhi. These vectors feeding on feces may transfer the bacteria from feces to healthy person through poor hygiene and public sanitation. Symptoms. And you remember, the incubation period varies from 1 to 3 weeks or average 2 weeks. The pathogen enters the small intestine and causes lesions in the intestinal wall and migrates to the other organs through blood. The symptoms are fever, sustained, slowly progressive or sustained high fever, 39 to 40 degrees Celsius, constipation, coughing, exhaustion, headache, loss of appetite, a loss of desire to eat, stomach pain, and sore throat. These are the symptoms. Sometimes what happens? The temperature goes on rising during first week and then gradually comes down. Relapse of is common, and liver and spleen become enlarged. In chronic cases, what happens? In the chronic cases, intestinal perforation that may leads to fatal also. The confirmative test for typhoid is Widal test or serological blood test. When you talk about typhoid, there is a classical example, typhoid Mary. A classical example for typhoid carrier is need to be mentioned here. Mary Mellon, named typhoid Mary. She was a cook by profession and was potential typhoid carrier who continued to spread the typhoid for several years through the food she prepared. Later, she was identified and she was quarantined in a hospital. Okay. So most she was that's why she was considered as the most dangerous woman in America. So this is about the typhoid. Next, we'll move on to the pneumonias. So pneumonia is another bacterial disease seriously affecting the lungs. It is an inflammatory condition of the lungs, mainly affect lungs. When you look at the parts of the lungs, the alveoli are the structural and functional unit of lungs, and these pneumonia mainly affects the alveoli. These are normal alveoli, and this is alveoli filled with a fluid material in case of pneumonia patients. That's why it's considered as an inflammation of alveoli. Inflammation of alveoli or inflammatory conditions of the lungs. And it is caused by bacterial pneumonia. That is one, Streptococcus pneumonia. The second one is Haemophilus influenzae. So, as a result of infection, the alveoli, bronchioles get filled with a fluid, leading to severe problems in respiration. The pneumonia is commonly affects children and old people. The symptoms, and one more thing I forgot to mention, the mode of transmission. The healthy person acquires the infection by inhaling the droplets released by infected person or sharing glasses, utensils with infected persons. Is that clear? Then the incubation period of Streptococcus pneumonia or Haemophilus influenza is just 1 to 3 days. Next, we'll move on to the symptoms. Cough, producing greenish or yellowish sputum, fever accompanied by chills, headache, blueness of nails and lips. Some in chronic pneumonia patient may develop cyanosis, blue or purple coloration of body parts because of decreased concentration of oxygen in the blood. So the diseases can be treated with the antibiotics. Okay. Shortness of breath, stabling chest pain during deep breath or coughs. Next, we'll move on to the common cold. So, common cold, it's a viral disease and also known by acute coryza or cold. You remember one thing, there are two inflammatory diseases. If inflammation occurs in the lower part of the respiratory tract, then it is called as asthma. Inflammation takes place in the upper part of the respiratory tract is called cold. Causative agent, A group of rhinoviruses. Group of rhinoviruses. Then coronaviruses. So these viruses infects nose and respiratory passage, but not the lungs. The mode of transmission: droplets released by infected person through cough and sneeze, contaminated object such as books, doors, knob, computer keyboard, mouse, etc., and cause infection in healthy person. Common articles of use. Symptoms: cough, sore throat, headache, running nose, fever, tiredness, and watering of eyes. Prevention: stay away from the infected individuals. Hand washing with a plain soap and water. Mechanical action of hand rubbing, rinsing, drying physically removes the virus particles. Okay, this completes the second session. In the next session, we'll discuss diseases caused by protozoa or protista. Thank you.